Welcome to Healthscope on WMKV and WLHS. Each week at this time, we bring you updates on a different medical topic and open the phone lines for you to join the discussion. Now, Healthscope on 89.3 WMKV, 89.9 WLHS, and online at WMKVFM.org. Good afternoon, and you are listening to Healthscope on WMKV and WLHS. I'm Robyn, and this last Healthscope before the Christmas holiday, I am very, very excited about our guest today. Christine Sansom, you will recognize Christine's voice and certainly her name from Homewell Care Services, and it's because of Chris that our other guest is here today, Llee Sivitz. Everyday things that happen to adult children as their parents age, you know, things like, should we move them closer to family? Is it time for a facility? Do they really need that surgery? What about rehab? Now, if these issues have arisen in your family or perhaps with you personally, this new book by Llee Sivitz, written with Dr. Edward Hanzelik, may just lead you to answers. And I have to say, I had the book over the weekend and read the first third of the book. It's divided into 3 parts, which was Llee Sivitz's personal story with her mom, and I couldn't put it down. So today on Healthscope, we are going to be talking about Llee Sivitz's book, Speaking Up for Mom. And Chris is here because Chris met Llee, called us, and said, I think she should be on this Healthscope program. So first, I want to introduce Llee. I'm going to switch it up here a minute. I hate that you're sitting here in silence. Hi, Llee.
Good morning.
Okay.
Or afternoon, sorry.
Afternoon now.
It's afternoon, thank you.
You sound like me. I'm usually on at 6 in the morning, so that's often how I will open Healthscope. Good morning. But it is afternoon, by the way, and we are live. I'm going to give the phone number out, too. You can call and ask questions, tell your own story, perhaps, of speaking up for mom or for dad. 513-772-9658. Now, Llee Sivitz, you may recognize her name as a writer for The Inquirer. In the early 2000s, she covered travel and fitness. She went to the University of Florida College of Journalism there in Gainesville and was, besides a fitness and travel reporter for The Inquirer, she's done a lot of public relations writing. Also, this book, Speaking Up for Mom, A Daughter's Quest for Compassionate Medical Care, is her first book, possibly not her last. She's married, has 2 adult sons, and her hobbies include gardening, health coaching, and traveling. I share 2 of those.
Oh, good.
Not 3. Running, no. Gardening and traveling, yes. And Llee, welcome to Healthscope.
Oh, thank you so much. I so appreciate it.
Absolutely. It's a powerful book, and I'm really excited, not just for you, though I'm excited you have your book out and you're talking about it and you're out doing the publicity, but for the many, many, many people that I think are going to be helped by what you've put together here. And Llee, just tell us a little bit about your co-author.
Yes, Dr. Hanzelik. First of all, I want to say what a wonderful man. He reminds me of a country doc. He's very much patient-oriented and the kind of doctor that will sit and listen and take time. And so I can't say enough good things about him. He is a board-certified physician with a specialty in internal medicine, and he received his medical training from the Albert Einstein College of Medicine and was a senior resident at Beth Israel Hospital in Boston. He also had a teaching fellow at the Harvard Medical School and was assistant clinical professor of medicine and family medicine at the University of Southern California College of Medicine. He recently retired, actually, just in February, from 45 years of private practice. Most of that was in Southern California. And he also has co-authored another book called The Inner Game of Stress. A really wonderful, wonderful man.
How did you find him?
Well, we had gotten to know each other at a conference we both attended, and what happened was when I wrote the first draft of the book, I sent it to him and asked him if he would be willing to review it for me. And it was so interesting, the feedback he gave me on it. He said, this story plays out 1,000 times a day in this country.
Wow.
And I was shocked because I thought my story was very unique. And when he told me that, I said, well, do you have anything you would like to say about it? And he said, I certainly do. And so that's how I ended up interviewing him and putting him into the book.
And Chris Sansom. Hello, Chris.
Hello, everybody. How are you?
Chris is a voice that you may recognize. She's with Home Health Care Services. Tell us a little bit, because you've just changed the name of the company, and just remind us what you do and also how you brought Lee to us.
Absolutely. So Home Health Care Services, yes, we did rebrand just recently. We used to be called Home Health Senior Care, but we've sort of broadened our horizons so that we're not limited to seniors. We can take care of anyone 18 or older. And we provide things like personal care, companionship. We do a lot of dementia care. We do a lot of, basic homemaking, anything like showers, med reminders, anything like that in the home. I love it. Been doing it 14 years. We have over 120 amazing caregivers and a great care management team. I just can't speak highly enough of my team and the work we get to do with our community. Lee and I met at a Christmas party, and we got to talking about her new book, and it really struck a chord with me. Speaking up for Mom, well, mine happened to be for Dad. My dad passed away suddenly about a year ago, and it was a 1-week whirlwind he was on vacation at a golf course and had an angiogram because they thought it was heart issues, and it was a small Hilton Head hospital, so they transferred him to a bigger hospital in Savannah. So that was a medical ride, and by that point, I'm hopping on an airplane because I'm in Cincinnati, and he's in Hilton Head, and I get there, and it just went from bad to worse. It was just a week of intense emotions. I mean, I've been a nurse for 30 years, but I'm still a daughter, and, you kind of get in that maze of healthcare, and you can feel very overwhelmed by people of authority and doctors, and sometimes you don't feel like, even though I'm a nurse, I don't have a right to speak up, or what can I say, or you don't want to offend anybody, but I found myself on more than one occasion raising my voice, getting upset, trying to advocate for my father, who at this point was really unable to speak for himself. I needed answers, and it was just the most stressful time I could have ever imagined in my life and my family's life. And, I'm thinking, I'm a nurse. I should be able to handle this better. But it isn't necessarily the case. You're still a daughter, and, your emotions sort of take over. And I love Lee's book because it's got some great practical tips on, what to be looking for, what kinds of questions to be asking, and how to be prepared, because you never know when you're going to get that phone call and you've got to jump on a plane and make decisions that maybe you haven't discussed with your loved ones. So I talked to Robyn, and she was so grateful, and I was so thrilled that Lee was able to come on because her book is fantastic. I think the listeners are going to just glean so much great information from it.
Absolutely. And like I said, it begins with Lee's personal story, and then the second and third parts of the book are more of the guidebook to help people avoid what both of you ended up experiencing.
Yes, the second part of the book is called The Doctor is In, and that's where I interview Dr. Hanslick. I call it having an office visit with him. And basically, I'm asking him questions about the way things went in my story with Mom, and how could they have gone better, and what did I not understand as someone who's advocating for her. And he has such a beautiful way of expressing what I needed to know. And I think your listeners, if they end up reading the book, please don't stop at my story, is my request. Please keep going, because that second part is so important. And then the third part of it is called 9 Important Lessons. And these, I distilled down what I didn't know and what Dr. Hanslick told me and what I learned from doing a lot of research. I distilled it down into 9 basic sort of areas of things that are really good to know. And I include websites and all kinds of references for people just as a starting point. This is not the end of your education, just the beginning.
But don't get overwhelmed yet.
Yes. It's a simple, easy read. It's not, it's nothing huge.
I'm going to read something that you included, which is just a quote from Dr. Hanslick, which is at the beginning of that section that you just referred to, 9 important lessons. And he writes, quote, "I feel the most important factor in the outcome of care is the clarity and strength of the caregivers and the people making the medical decisions to do what's best for the patient. But the medical environment is quite intimidating, and the decision makers need support and even training to handle their responsibilities effectively." So there, from the doctor's mouth, how important even training to do this. Well, I think you even reference it, Lee, in the book at some point, that the other thing that we're never trained for is being a parent. And so,
right.
there's no classes you go to. You've got 9 months. You can use it however you might want to use it, either getting ready and learning or, just waiting for the baby. And then once they're born, oh my goodness, then the handbooks are available. But, for this, how many of us have ever thought about being prepared for the end?
No.
Right.
No.
Right.
We prepare for parenting. We have a chance to do that. So maybe this will, and Chris made a really good point to me last week when we were talking about preparing for this program, that the holidays could afford a really nice opportunity. And go ahead, Chris, and finish.
Yeah, I mean, obviously families sort of gather together, and it's so good when you're able to talk about difficult topics. It doesn't have to be a terrible conversation,
right.
But there's not a crisis going on. Hey, Mom and Dad, how do you feel about if something were to happen? Do you have a DNR? Or, I do a lot of assessments, and I meet a lot of families, and I'll ask questions like, are you power of attorney? And the adult child that's usually in the room with me is, sometimes I'll ask, am I a power of attorney? They don't know. What does that mean? Are they a DNR? So it's great to have the conversation at a calm time when it's not a crisis.
Maybe a way to, at least for these listeners this afternoon, a way to bring it up, because you're thinking, the holidays? Are you kidding me?
Yeah.
You heard something on the radio.
Right.
You want to know how the other members of the family feel about it. Yeah. Maybe we could be your
talking point.
Yeah, your talking point, the way to a way to start. But Lee, tell us more. Why did you write Speaking Up for Mom?
Well, it kind of segues exactly into what we were just talking about. I'm going to be very transparent here and say that I did not have that important conversation with my mom. She was in her mid-80s. She had several, health issues going on, some of which I didn't know about. But it seems now, looking back now, it was crazy not to have that conversation with her, but I never did. And it was mainly because she was very reticent about it. She did not want that conversation, and I did not want to make waves. So that was part of the issue there, was our communication skills were not good. And I also didn't understand the importance of that conversation. It's important to have it before a crisis happens, when you're clear thinking, you're not under stress, when you can really really think about it. And so we were actually in the throes of her, what I call critical care, end-of-life care, before I realized, oh my gosh, I don't know what she wants, or I'm going to have to guess. So that was the main thing. I didn't want my 2 adult sons and my husband to have to experience what I did as an advocate for me. Mm-hmm. So that was the one thing I was trying to do. The second thing was when Dr. Hanslick told me what he told me, that this plays out 1,000 times a day in this country, I realized, wow, this information is more than just for my family. This is for anyone who is willing to listen and to take it to heart. And then the third thing is, I just think that this is a topic that really needs to be brought out more. Mm-hmm. I think that a lot of people experience these things, and they just don't know that they have a choice, that they can be empowered in the situation.
A very good point. It's something that it's not easy, so we tend to put it on the back burner, and you could put it on that back burner, but anything. I mean, Chris, your dad, you thought he was enjoying vacation and playing golf, right, which he loved, I understand.
Oh, yeah.
Huge golfer. And within an hour, half hour, minute, things all changed. So, yeah. So let's continue. I would love it, Lee, if you would read just a little section of your book, and this is, of course, in your part where you tell the story that leads up to why all the information in parts 2 and 3 are the guidebook part, but this is your personal story.
Right, and this is the point in the story where my mom has now been moved. We've moved her from Florida, where she was living, and I was doing long-distance care, to moving her up here to Ohio to make it easier for our family to take care of her.
And how long after she started to have some problems were you living in 2 different states? How long was she in Florida and you were up here in Cincinnati?
It was about 2 years.
And you were going
I was flying down, well, I think it averaged about 6 times a year for 2 to 3 weeks at a time, just to take care of what was going on with her. However, I also began to notice more signs of Mom's dementia. At first, I thought it was due to the trauma of relocating, and I imagined it would clear up with time. But it didn't. She would seem okay, and then out of the blue, she wasn't. Time and time again, there was a decline in some functionality or life skill. But rather than a fast downhill slide, it was more like a slip and then a plateau where everything seemed to stabilize. Then another slip and another plateau, a slip and a plateau, almost as if life was fortifying itself for the next plummet. Looking back, I believe there was mercy in all of this, although I didn't recognize it at the time. As Mom's memory problems increased, I did my best to work around them, not mentioning what I saw and just allowing her to live independently in her new home, discreetly transferring one daily task after another from hers to my responsibility. I'm sure at times she knew what was happening, yet like myself, she preferred to live in denial. My husband tried to point out to me where this was headed, and he really did. And I wouldn't hear of it. It was partly because, despite the inevitable changes, one thing didn't change. Mom's desire and ability to appreciate didn't diminish. I witnessed her enjoying little moments like spending time with family, being surprised by a beautiful sunset, or devouring a bowl of ice cream. And as her caregiver, I wanted to maintain my optimism that she could continue to enjoy life. Of course, it was up to her to take advantage of those opportunities, and she often did. Nevertheless, it wasn't long before the admonition that she did not want to be a burden crept into our conversations, always followed by my irritated insistence that she wasn't. I didn't realize at the time that perhaps she had a vague sense of what lay ahead, which was compelling her to say those things. Regrettably, I never asked her exactly what she meant.
I think that says so much in that passage. And the dementia aspect, how much did that impact your role as a caregiver? And then they were little glimpses of dementia at first. Did you think that's what was going on?
I didn't really know, because I felt like when she started really getting more into the healthcare system, she was having more doctor's appointments and outpatient surgeries, and her medications were getting stronger, and she was getting more medications. I thought perhaps this was part of the issue that was going on. She was, body was trying to stabilize and all this. But then she would do things like she would call me up and she would be almost in tears, and she would say, "Lee, I hid my purse to test myself to see if I could find it, and I can't find it." So I knew she was aware that something was going on. But again, we didn't have that open communication, which would have said, where I could have sat down with her and said, "Mom, I see some things going on. Can we talk about it? Do you need more help? Do you need more support?" We just pretended like it was all okay. And so when we finally ended up in the emergency room and she started really having major issues, all of a sudden that dementia aspect of her thinking became very apparent and was a major issue in her care.
To your credit, I don't know how much you've beaten yourself up, for the 5 years that you took care of your mom. But, people are looking for the bright side. So my mom's one of those people who will pull over the car to look at a sunset, or a specific tree. And so your mom reminded me of my mom. in that way, and that I would grab onto that thing that that she was in the moment and noticing and celebrating. I would go with that. I can see that so easily without thinking about the more negative things or the things that were slightly questions perhaps in the back of your mind. So right. I just think as reading this and not having even met you when I read it, that those reactions would be very, very normal, I would think. I don't know, Chris. You have the experience talking to families all the time.
Oh, I totally do. And I kind of sit here and I wonder, when you're trying to advocate and you're guessing over the phone what is happening in Florida, because you're not there. You get snippets and bits and pieces, and you don't always get the whole story. And when I talk to the families that I've dealt with over the years, a lot of them, mom and dad are very proud. They're 85, 90 years old. Nobody's going to tell them that they need help. We totally get that, but they don't want to upset mom and dad or rock the boat. It's hard to interject yourself into that, but sometimes it is very necessary. I just am curiously if when you were kind of going long distance, did you know of any companies like Homewell, was that even in your repertoire of there's help out there, I can't be there? Were you aware of those kind of things?
Well, yes and no. I did some research. I had some suggestions. My mom would not listen to those suggestions. Having talked to people like yourself, Christine, I'm now understanding that people often say no to things when they haven't experienced them or don't have a sense of what's going to happen. Their first inclination is to say no. Mm-hmm. And that it might have been something that I could have gradually worked on with her to introduce a little at a time to get her the understanding. And also, I do want to say, looking back on my story, researching, talking to people like you, I understand that I personally needed additional support. Yeah. Mm-hmm. And because I felt it was uncomfortable for her at the beginning, I didn't take into consideration how am I going to be the best advocate I can be for her if I'm burnt out. Mm-hmm. And that was a major point for me, was to figure that out later. Mm-hmm.
Yeah.
But yes, for sure.
I know that when I'll get daughters, sons, family members calling me to talk about mom and dad, and they don't know how to have these discussions, and they know mom needs help. They know there's going to be resistance. And, I feel like people that are in our industry are very good at being that middleman, starting those conversations. Oftentimes when I'm doing an assessment, like I said, it's the first time families, it's kind of it's out in the open, and it's a way to start the conversation. But I can, if you will, the professional might be the bad guy, the one that's seeing some deficits or suggesting a little care might be helpful. And I usually say, your children obviously love you, they're concerned, and they just want to see what options are out there, and care at home is just an option. But I share everything I know, and I'm sure most home care companies do that, because it's not a cookie cutter situation for anybody.
Yeah, it's well put. Now, at one point in your story, Lee, your mom went from, bad to worse, or just to worse, from a situation where you probably weren't entirely sure what was going on with her. Mm-hmm. And it was really catastrophic. And at one point, did you realize that, wow, I'm a bit in over my head? Was that when she had that medical catastrophe? Can you give us the background on that a little bit?
Sure. So I called her up one day to tell her about her doctor's appointment. I never told her the night before because she would get anxious. Mm-hmm. And she was talking gibberish to me over the phone. It's the best way I can put it. And I knew something was wrong. And I went over to her apartment and realized that she was not, something was happening with her.
And this was after she had moved to Cincinnati?
She was now in Ohio. Okay. Yes, we were seeing her almost every day, taking care. And so we ended up taking her to the emergency room. The doctor said, take her to the emergency room. So we did. And that was the beginning of a 3-month saga that ended with her passing. And I do say in the book that moment where we had to make the decision whether to go to the emergency room or not, I let her decide. And she finally said, yes, I should go. And then I do say in the book that was the last time she made a decision for herself until the day she passed. And I think that was one of the impetuses for writing the book, is because from there on out, the waters got very muddied as far as what her wishes were, what I was supposed to do. It just became, well, it's a pretty compelling story, I will say.
Yeah. You need to read the rest of the story. It is really something. Yeah. So then, what does speaking up mean to you?
Wow, it means, first of all, it means knowing and listening and understanding what your loved one wants. That's the first thing. That they have every right to make a decision about their own life, just as we all do. I mean, that's what we all want, right? We want to be in that position. So to let them tell us what they want and to accept that's what they want, and not to represent them. First of all, let them advocate for themselves, which is really important. They can advocate for themselves, and be that just amener, be that person that just says, yes, this is what my mom wants, this is what she should get. If for some reason that person can't represent themselves, then it's up to that advocate, that person, to make sure that that loved one's wishes are the wishes that are front and foremost of what's going on, which, as Christine mentioned, can be hard, because you're going to have doctors and nurses and possibly other family members trying to give you a lot of input. But the third thing is, if you do have to speak up, to do it in a way that the medical staff can hear you. And this is really, really important. And Dr. Hanslick was so beautiful. In part of his interview, he talks about how do we communicate with the doctor. It's just the way we communicate with anyone, actually, that we know that when there is acrimony in our voice, people shut down and don't listen. When we yell, when we cause a scene, people don't listen. So how do we do this? This is where the real skills come in, because we have to not only know what our loved one wants, but we have to be able to communicate it well. And this is where we all need to really get some skills, and so that they can get what, because the object is for them to get what they want.
Right.
And whatever it takes. If it takes being super nice to somebody that you don't want to be to, you do that. You do whatever it takes. You speak up. You raise your voice if you have to, but that should be a last resort, because most of the times when we do that, people shut down and don't hear us. So,
wow. We're going to take a short break and continue another half hour of live Healthscope today. Our phone number, if you'd like to call in and join this conversation, is 772-9658. I'm talking with the author of Speaking Up for Mom, Llee Sivitz, A Daughter's Quest for Compassionate Medical Care, and from Homewell Care Services, Christine Sansom. We'll be right back.
The views and discussion expressed on this program do not necessarily represent those of the hosts of the program or of WMKV Radio, Maple Knoll Communities, WLHS Radio, the Lakota Local School District, or its staff or management. Discussion of specific points and general topics on this program are not meant to be taken as specific professional advice.
Good afternoon. We are live on Healthscope on the Maple Knoll Radio Network. And happy Hanukkah. Merry Christmas to all. Thanks for listening today. This is a really powerful conversation. And if you have a question or a story you'd like to share about being a loved one's advocate, you can call us, 772-9658. There is so much of this book, once you get through the very compelling and beautifully written story of your own experience with your mom, Llee. There's just a fabulous how-to guidebook filled with scenarios and how to deal with them. But let's talk, because patients' rights is a big part of your book, a big part of the topic. Talk a little bit about that.
Sure, and that goes right hand in hand with speaking up. You need to know what your rights are so that you can speak up about them. And one thing that Dr. Hanslick said in his interview, which I thought was so telling, he said, what's the first thing you're asked to do when you are admitted to an emergency room or hospital? What would you say?
The first thing you're asked to do?
Yes.
Give me your insurance information.
Well, I say your name and your birth date. Your name and your birth date.
Okay. Well, once you get past the paperwork, what's the first thing?
what's going on? How is she? What's happening?
No. The first thing they tell you to do is take off your clothes.
Wow.
True.
So think about that.
I was thinking in terms of what I would ask. You're asking what would they say most likely the first thing when you walk in the ER.
Right.
Yeah. Take off your clothes.
Right.
Put this on.
Right. If you need to go to the bathroom, you need to ask. If you want something to eat, you've got to ask if you can have that. If you want to get out of bed, if you want to go walk somewhere, you have to ask. So when you walk into a situation like that, you can very much feel like a victim. You can very much feel like you are being subjugated.
Mm-hmm.
And that doesn't need to be like that. I mean, I'm not saying you shouldn't take off your clothes if they ask you, well, you need to do that, you need to do that. But the point is that we can take these sort of social cues and find ourselves feeling not empowered. Mm. So the thing is to separate ourselves from those different things that are going on and understanding that we do have power, and our patient rights is a good bit of that.
Yeah, loss of control, that's a huge thing for people, and I could see that happening. I used to be an emergency room nurse, and boy, that brings back memories.
Yeah. And that's such a good point, too. You've got to think of those things through the eyes of the person you're taking care of. Now, your mom didn't like doctors. A lot of that is, and for obviously very good reasons. When you read the book, you'll know why Lee's mom did not have a real good experience with the medical field prior to. So walking into one of those sterile environments, so much is going on. Here's all this machinery, and then saying, take off your clothes.
Right. And Dr. Hanslick also quotes from a book called Medical Nemesis. And in that book, the author says that you should never enter a hospital alone. And we're not talking about just going to visit somebody. Right. We're talking about when you're being admitted or going to them, you should never go alone. And there's a very good reason for that, because when we are in that state of stress and we're not feeling well and we don't know what's going to happen, we can't think clearly always. We don't know what questions to ask. So it's important to have somebody there that can be our advocate if we need it. So anyway, getting back to the patient rights. If we realize that we have patient rights and we know what they are, then we can speak up. And usually, it was hard to find patient rights. They weren't posted where you could see them. These days, I'm amazed. I was recently, when my husband was in the hospital, I was there in the lobby. A big thing, patient rights and responsibilities. Now when you get your paperwork when you walk in, would you like a copy of the patient rights and responsibilities? You go to the doctor's office, often by the counter. There it is, patient. But we never read it. We just kind of we're looking at our magazine. But this is really where we can find out what are our patient rights. And we have two very good ones. So these are the two patient rights that we have that are so important to know. One, we can ask questions. And two, we can say no. These two things can change your experience. From my experience in the hospital or rehab setting or wherever you are, you have to understand these are your rights. Your right to ask the questions and your right to say no. Do you want to add to that, Christine?
I totally agree with what you're saying, and I think that asking questions can be intimidating because you're not in charge anymore. Somebody else is in charge of your care, or at least you think they are. Your perception of what's happening is you are no longer in control. Somebody is now going to decide if you're going to have lab work done or if you're going to get an IV or you're going to have a procedure, and suddenly you feel like you don't have a say. You just have to do what they tell you to do.
Right. And one thing that Dr. Hanslick pointed out was, most of us have cell phones these days. So when you're in the hospital or you're in an emergency room or whatever, and a doctor says, okay, you've got this prognosis, and this is what we want to do, you can pause for a moment and say, well, give me a few minutes, and you can pull out your phone. You can start looking these things up. What is this? What is the prognosis? What are the various treatments? You can educate yourself a little bit. So when you do ask questions of the doctor, they're intelligent questions. You're not just pummeling the doctor with questions, but you have intelligent questions because now you have a little background. And I think that's important too. something Dr. Hanslick really emphasizes is do your homework so that you know how to intelligently ask a question.
And we do talk on this program, even just a week ago, about not Googling randomly on the internet to look up.
Oh, absolutely.
Yeah, to look up, prognosis or get into chat rooms when people are talking about a health condition. Because you can all often get misinformation. So, I guess credible sources for that information.
And Dr. Hanslick mentions the Mayo Clinic, the Cleveland Clinic, even WebMD has some good things.
Those are the three that I have, the only three sites that I have heard medical professionals mention, because I guess they're peer reviewed. Exactly. So they're reviewed by other medical professionals.
So when my dad was sick and going through his traumatic event, my sister was brilliant. When you said this about the phone, she recorded a lot of the doctor's conversations because we would find ourselves, now what did the doctor say?
Absolutely.
And trying to recap, we didn't remember because we were exhausted, we had not slept, and we weren't thinking clearly. So I'd use my phone as a recorder, too.
Absolutely. In fact, I was going to mention that, too.
Yeah.
I shared with Chris and Lee that my mom, because of her experience over 30 years ago, or almost 30 years ago, taking care of her mother, that she has become this very good, she's a great person to take to the doctor with you, I'll tell you that. And she always uses a recorder. Mm-hmm. And if you can't have someone go with you, like you had said earlier, Lee, if you're being admitted, go with someone. At least record everything. And you can do that right on the cell phones now with the voice notes. So,
one thing I will mention, though, and this is from personal experience, some doctors do not want to be recorded.
That is true.
And so you don't necessarily have to ask permission, but if they don't want you to record, they will definitely tell you. I've been in that situation.
Interesting. Now I'm scratching my head. Why?
Fill in the blank. I'm not going to say.
I think I know. That's unfortunate because it seems like that would be your right.
But I think common courtesy, you should say, would you mind if I just, recorded this so that I have it for future reference because I'm not thinking clearly right now. It's okay to tell your distress to the doctor. And if he says no, do your best at writing it down, taking notes.
And some doctors will have, where they're typing everything in while you're talking, and then you can get a printout of that. Mm-hmm. I've received that before, which is good. So at least if they say they'd rather you weren't recorded, if they would prefer not being recorded, then maybe you can ask, well, then what is another alternative for me to get this information out the door?
Very good.
Yeah. There we go.
You're good. You're getting it.
Okay. Oh, my goodness, so much. So let's explore a little bit what else. How can you best summarize for listeners? Because I think this is so important. At the break, we were talking among ourselves that this guide, the guidebook, the how-to, the 9 important lessons, and the middle section the doctor is in provides some really good information for anyone. How can you best share with the listeners what all that good stuff has for them?
Oh, well, it covers quite a bit. Certainly it covers how to have, starts to give you guidelines on how to have that important conversation with someone about their end of life or critical care. And that's really important because we often don't know how to talk about that. Another thing it talks about is how to make the most of a doctor visit. Because, again, there's tools that we have that we can use if we're an advocate or if we're the patient itself, himself, herself. There's one suggestion that if you, as an advocate, if you know your loved one is going through something that perhaps you don't want to bring up in front of them, you can call ahead and say, in our next appointment, would you please bring this up to the loved one? Which is really great that you can do this.
Sure is.
Or say you're in a hospital situation or a rehab situation with your loved one, and you have something come up where you haven't seen the doctor, and you have let's say a physician's assistant there, but you really want to talk to the doctor. You don't have to try to wait for them to come around to rounds and try to figure out when they're going to be there. You can call their office and say, I'd like to make a phone appointment, or I'd like to talk to you even before you come to the hospital. So there's ways to sort of, work with the system. And I think that's the point of the book. It's like, yes, it's not perfect. It needs a lot of work, but there's things that we can do that we don't even know are available to us.
Huge.
Yeah.
Those couple of points right there are huge takeaways. My goodness. Again, you don't know what you don't know.
Yes.
So take
But how
advantage.
scary would that be,
Oh,
really?
yeah.
I mean, how scary? I mean, I'm a nurse. The thought of, trying to ask a doctor to, I don't know, to make an appointment to talk to him before he comes, I get nervous because I think they're so busy. They don't have time for me. But I think it's so great that you're bringing it up. It is absolutely our right, and it's your right as an advocate to, if you have questions, to make sure you figure out a way to get them answered.
Yeah.
Right.
Doctors put their pants on one leg at a time like everybody else. They're not God. They know they're in a position of knowledge and support, but those are such great tips, and I have a feeling there are many, many more in the book. Just not enough time today to talk about all of them. What you sent me some wonderful questions to share with the listeners, and I think this is a great question, Lee. What would you say to someone who's stepping into the role of patient advocate, or to a person who's designating someone in their role as patient advocate? Now, where would there be a situation where you're designating someone? Is that like in a family situation where?
So basically, we should all have a healthcare power of attorney. That's what it's called in this state. It's called different things in different states. We should all have one. When I do a talk, I will ask the audience, how many of you have designated a healthcare power of attorney? Most people raise their hands. Then I will ask them, how many of you have been designated by someone else to be a healthcare power of attorney for them? And maybe that point, maybe half the people raise their hands. Mm-hmm. And one thing people may not realize is if you're married, you're automatically the healthcare power of attorney for your spouse. And if you have a child under the age of 18, you're automatically the healthcare power of attorney for that child. So in a lot of cases, we are healthcare power of attorneys and don't even realize it. And then the third thing I ask is, okay, those of you who are either have designated someone or are that person, how many of you have had that conversation about end-of-life wishes? And almost no one raises their hand. So that's always kind of a telling moment.
Yes. Oh, for goodness sake. Yeah. So we have to bridge that gap between I am a power of attorney and what the heck does that mean? And what do I need to know before I'm put into that situation?
Yeah, and I think that's almost the crux of this whole issue is that conversation, if you've had it, things in general will go a whole lot easier, and if you haven't, believe me, it's no fun.
Yeah, fun. You went through a lot. Your story in particular, Lee. You sound like came full circle, and I'm sure writing this book, Speaking Up for Mom, has helped sort of the whole healing and grieving, about your mom, because this coming out of this is so much positive for other people. But what you went through was really tough. And as I mentioned, Lee's story is at the beginning of the book. Now, Chris, you had mentioned earlier, now you're with Home Well Care Services. Can you help people with that conversation?
I find myself helping with that almost at every time I meet with a family in one way, shape, or form, because, like Lee said, you don't know what you don't know. I've been doing this a long time, and I am a nurse, and I do share that with families because it's an opportunity. Oftentimes it's an uncomfortable conversation, or no one really knows where to start the conversation, but it's pretty easy to do if you're allowing your mother or your father, whoever you're trying to get the information, they need to be part of the conversation. Don't talk around them. Bring them into the conversation. Yeah. It's okay to say, your daughter and son, it's the holidays. They've been a little worried. They see that, you're missing some medications and, you're not paying your bills or whatever the case may be. And they ask me just to come and talk to you. And I say, so, do you have a healthcare power of attorney? Do you have a living will? Do you know what that means? I said, I'd like to share that information just in an open format so that everybody kind of understands what we're talking about and why it's so important. You're not in a crisis right now. Little things are starting to slip, but this is the time to get the important stuff kind of put to bed so that you can enjoy each other when you're together and not be worrying about the what ifs down the line. You know, it's a good conversation to have, and I feel like we do a good job. Most healthcare professionals, if you are open to it, are very good at opening that dialogue and starting that conversation.
Because having that a person outside of the family circle,
exactly,
you can go where others may not be able to go so easily.
Yes.
Yeah.
Robyn, one thing I want to mention, though, I think is very important, is when you have that conversation, you have an understanding. Maybe the person has filled out, as part of their last will and testament, they filled out a living will. You have your health care power of attorney in place. All these things are great. But when you go into a hospital setting, you have to have those turned into doctor's orders. That's very important. You can't just walk in and say, well, this is what we want, and then know that it's going to happen. They have to be turned into doctor's orders. And Christine mentioned the DNR, which is Do Not Resuscitate Order, which some people feel they come to a point in their lives where they don't want heroism in order to survive with the quality of life that they would have. And that has to be a doctor's order. There are other things. There's the pulse, and I won't go into all of it now. It's in the book. But there's a way to turn some of these requests of your loved one into doctor's orders, and that's the only way that they're followed in a medical institution. So I just want to make sure that everybody understands that.
Thank you for bringing that up, because
Sure.
there are several examples in your own personal story where, what?
Yeah.
Didn't realize that you thought you had what you needed, but you didn't.
Correct.
So can a DNR then be, if someone has made that decision, not even knowing how or if that would need to be used, can you have a DNR in a file for yourself that has also been approved by a doctor ahead of time?
Yeah, a lot of people will carry their legal documents, a legal DNR, healthcare living will, power of attorney. That'll stay in their electronic records, or a lot of families carry a binder or a notebook just to keep that around.
Okay.
Mm-hmm.
Yes, your primary care physician can provide one. And then when you go into a hospital setting or rehab setting, then it has to be the attending physician there that provides the DNR.
So you may have to have it looked at again and signed again.
Correct.
Okay.
That's correct.
Wow. So, and your book has a lot of these
Yes.
things that there must have been some long conversations with Dr. Hanselick as your co-author, getting to the nitty-gritty of all these things. Another wonderful question that you suggested that we launch, and again, you're listening to Healthscope live on WMKV and WLHS, and there's still time to call 772-9658 if you'd like to share a caregiving story with us or ask a question of Lee or Chris. Do you think our medical system can change and become more user-friendly?
Yes, I do, because it's just made up of people, and we can do anything we want. You know, we can change things. We can make them better. We've proven that again and again. As a humanity, we can do that. But when is it going to happen? Will it happen in my lifetime? Will it happen in your lifetime? Possibly, but then maybe we can't wait for that, because we are where we are right now. We have our issues and our health concerns right now. So this is where I feel the book really comes in, because if we are able to exercise our patient rights now, which we can do, that will change our situation, whether the system changes or not. And I also really feel the more we exercise our rights and become empowered in the situation, that will also be a grassroots, you could say almost, type influence for the system to change. And I'll give you an example. When my husband was recently in the hospital, he was very clear-headed and advocating for himself. I was just there as an amener. But that's what I call it, you know, in case there was any pushback. I was like, no, he wants this, make sure he gets it. But anyway, but he would advocate for himself, and he would ask questions. They wanted to give him a new medication. He would ask, what is it for? What are the possible side effects? And then he would occasionally say, no, I don't want that. And it was amazing to me. They would answer his questions, and then when he said no, they would say fine, and they would pack it back up and walk out the door. And I was like in shock. I was like, wow, this really works.
Wow.
So, yes.
Affirmation.
Absolutely. So coming across with confidence, with kindness, consideration, but just being clear about what you want, it's amazing what can happen.
Chris, thoughts?
Yeah, I think sometimes just this whole conversation, you might want to have it with your family or your parents or whatever, but sometimes it's really good to have that conversation with yourself first. Sure. How do I feel about these things in my end of life, and how can I empower and advocate for myself?
That is a
it's brilliant, right? And
yes.
But reading Lee's book, I think if families are wondering how do I start this conversation, load yourself up with the knowledge. Like, this is very layman's term. It's so simple to understand, and you don't have to discuss every topic in the book, but it's a great way to at least arm yourself with information and be able to help your families make some difficult decisions and know how best to advocate for yourself, your family, friends, whatever it might be.
I think walking in the door with Speaking Up for Mom facing out to the cover as you walk into the doctor's office would be the way to do it.
Right. Absolutely. It's
right here.
It's a great tool.
Really excellent tool. And here I had an experience when my father passed over 30 years ago where I felt helpless and didn't know how to advocate. You just a little over a year ago lost your dad, a totally different situation, a sudden crisis, an overnight crisis, and even as a nurse professional found that there were challenges. Yeah. And here, Lee, you have come through another completely different situation with your mom, and there was a result with this book. So anything could happen at any time, but I love Chris saying, what do I want? Mm-hmm. And filtering it through your own head about your own feelings about all this. Yeah. It's a great idea. I've never done that.
No.
I mean, I fleetingly, cremation, check. That's about as far as I got. There's about a lot between now and then.
I know.
And your last wish.
I know. I remember my mom and dad when they went, about a year prior to his death, they went and bought their burial plots, and they decided they were going to be cremated. I'm like, what? You want to do what? I mean, I never even thought that was ever going to happen, that the cremation would come into the picture. So you need to be open and understanding when you do have these conversations. Your views may not be the same. That's okay. But, be honest and true to yourself and just get the talk out there and start the dialogue.
And as far as medical system changing and when, we've had people sitting right where you are the last couple of weeks, including the Dean of the College of Nursing at UC, Greer Glazer, talking about the future of medicine and that we are going to have to be more and more our own advocates as healthcare changes with the influx of technology and all these changes. So it's sort of come as like a perfect storm is sort of happening, and then with the silver tsunami, as it's referred to, with all of us boomers aging, and Lee, I think you and I are probably pretty close in age, there are a lot of people in our situations right now.
Yep. Sure.
The holidays, again, folks, a great opportunity perhaps to bring up some of these topics with your siblings, or your parents, or uncle or aunt or grandparent, whoever it might be, when things are non-stressful. Of course, the ha-has. The ha-ha is that the holidays can't be stressful, but during this time, think about it a little bit. This is a great opportunity. And Lee, how can we get more involved in what you're talking about, and where can the book be found? You also have, since I joined your book Facebook page, you said that you have another Facebook group. So.
Right. So the book itself can be found on speakingupformom.com. You can buy the book there. There's also just an introduction about the book, and you'll see the contents and so forth. I also have a Facebook page for those who do Facebook called Speaking Up for Mom. Be delighted for you to join that page, to like it and to post. And then also I have just started a new group called Practicing Patient Advocacy. It is a Facebook group, and if you would like to join that, just simply send me a request for an invitation. I'd be happy to add you.
And I want you to close our program today with this beautiful poem that you wrote.
Sure.
And this is in the book, too. Your mom's just gorgeous. What a beautiful picture of her.
I know. And once you read the story, I think this poem will even make more sense, perhaps, because you'll get a little glimpse of her a little more.
Yeah.
But my mom, naive, yet daring, gentle and kind, yet a darker side, stubborn, afraid of anger, eager to love, looking in the wrong places, finding the wrong love, wanting peace, looking in the wrong places, trusting me sometimes, but not trusting life, loving the sunset, yet never seeing the sun rise, reluctantly aging, but aging gracefully, a kid in grandma's shoes, a reason to be alive, not fear, but joy, for what was given, and hope that it was enough.
I read the poem several times. I heard it for the first time.
Wow.
Thank you. You're listening to Healthscope. We'll have a replay of this, and it will be available as a podcast at WMKVFM.org. Thank you so much, Chris Sansom with Homewell Care Services, and Llee Sivitz, the author of Speaking Up for Mom, speakingupformom.com. You can find the book. Merry Christmas. You've been listening to Healthscope on WMKV and WLHS, and streaming around the world at WMKVFM.org. Join us each week at this time for a discussion of the latest in medical technology issues and topics on 89.3 WMKV, 89.9 WLHS, and online at WMKVFM.org.